Hello everyone, I'm urologist Omar Erdamakaya. I will talk about shock wave therapy. Why? Because when you enter the internet, one of the first treatments you come across is shock wave therapy, friends. The patients have two questions about shock wave therapy. One of them is that if they will benefit or not after spending money and time on this treatment. The second question is, how long its effectiveness will continue if they have this treatment. 1 year, 2 years, how long will it last? You can find many videos about the answer to the first question. I made this video especially for the answer to the second question. So how long does the effectiveness of shockwave therapy last? When is it necessary to do the next shockwave? To be honest, the comments in the videos you have seen so far on this subject are not actually very scientific. Because the first scientific data on this subject came out just this week. In the publication, they did shockwave therapy and followed the patients for 3 years. Over 3 years, they evaluated how the patient's responses changed. The effectiveness of shockwave therapy can continue for up to 3 years. Especially in the first year, as it peaks towards the end of the first year. Towards the end of the second year, its effectiveness starts to decrease. During the third year, between the 24th and 36th months, its effectiveness still continues, but in a reduced manner compared to the first year. So when we look at it, it seems that shock wave therapy can actually be repeated every 2 years, friends. The device used in this publication is an old device. I would also like to return to this issue, friends. In fact, shockwave technology is about 40 years old, maybe even older. It doesn't change. The technology is the same, friends, but the machines are constantly changing in look and continuing to be sold, friends. It is marketed as a new machine with minor changes. As you can see here, an old device has already been used in the publication and its effectiveness is very clear. When you do scientific research on new devices, there is no scientific data, friends. There is not even an animal study, let alone a human study. You shouldn't get too caught up in device marketing videos. First of all, shock wave therapy is only a part of erectile dysfunction treatment. No matter which center you go to, when shock wave therapy is applied to you, medication is definitely added to it. No center gives shock wave therapy alone without drug treatment, friends. In addition, if the new devices were very good, you would see a lot of them side by side in all private hospital chains. Because they are not very expensive devices and after all, the man has a private hospital. He spent millions of dollars there. I mean, if the shock wave device was of good quality, wouldn't he put it? He would put a lot of devices side by side, as I said. As a result, there is no point in getting too hung up on the brand and model of the device. So maybe one is 98% effective and one is 95% effective, friends. Of course, we should not oppose technology. We should not stand against technology, but as I said, there is also the effectiveness of old devices. Let's go back to the first question. Will I benefit from shock wave therapy? Will I not? Friends, there are many studies saying that, in order to see the effect of shock wave therapy you should have mild and moderate erectile dysfunction. When there is a severe erectile dysfunction, friends, your chances of benefiting from shock wave therapy are greatly reduced. They have put this forward in many publications, scientific publications. If you have severe erectile dysfunction, you need to receive many treatment alternatives such as shock wave, stem cell therapy, Botox treatment at the same time. Or you need to have penile prosthesis implantation. Shock wave therapy alone may not be enough for patients with severe erectile dysfunction. The patients in the publications are selected patients, in other words, these publications are made by selecting the group that is likely to respond to the shock wave. But if you look at my general experience, more than half of the moderate and advanced patients, that is 60 to 70%, do not respond to the shock wave. Why don't they get the answer from the shockwave? Because the patient's lifestyle changes have not been made. Weight loss has not been achieved. Metabolic diseases such as diabetes and blood pressure were not evaluated. If he was on blood pressure medication, diabetes medication or other psychiatric medications, these were not assessed. Testosterone levels were not optimized for their patients. In other words, when shockwave treatment is given to anyone without a complete evaluation, the results are of course worse than scientific publications. Patients end up wasting money. As I said, shockwave therapy is only part of a whole. And shockwave therapy has become a part of marketing. I do shockwave therapy too. Because on the one hand, it is written in our treatment guidelines that it is one of the treatments that we should do. But the patient's expectations should not be too high, friends. In other words, we need to evaluate the patient very well, and we need to tell what the answer would be from this therapy accordingly. We should not sell hope. After all, they are spending money on it. They are sparing time for the treatment, and it is necessary to give the patient the expected result of this treatment. Of course, you should not be completely hopeless. It is also necessary to promise hope to the patient. It is necessary to understand the psychology of the patient. Because here you are not only treating the patient but also the patient's partner. This is also very important, friends. Treatment of erectile dysfunction is not like the treatment of kidney stones. Even if the patient is depressed, or his partner is upset, you remove the kidney stone and treat the patient. But this is not the case with erectile dysfunction. If there are problems in the patient's psychological state, if there are problems between the patient and his partner, you need to fix them so that the patient's erectile functions will be better. So it is not a treatment like kidney stone treatment. You need to recover the patient both mentally and physically and together with the patient's environment. Erectile dysfunction is such a disease, friends. This is the case. Thank you for listening. Best regards.